Well, hello there, Paul Fitzgerald here, and thanks for giving me the privilege to have a chat with you for a short while during your busy day. Today we're going to be talking about how you can achieve some key goals in your practice. I'll be showing you how you can take some action right now to put some things in place that will significantly improve how your practice runs, give you better patient outcomes, and also reduce your risk of burnout. Now, burnout, is it a real issue? Well, over 50% of clinicians report some level of burnout during their career. In a recent New England Journal of Medicine report, the admin load was by far and away the biggest cause of burnout in clinicians. Now I'm going to show you some ways that you can reduce your admin load. Let me ask you a question. What if your practice was a hugely valuable asset? What if it was full of happy staff who loved their job? What if you were blessed with patients who love you and what you do and tell others about it? Would that give you peace of mind, let you sleep better at night, and maybe reduce your risk of burnout, knowing that you're building a legacy and a valuable, saleable asset for your long-term future? Or would you love to retire when you want to retire and not have to practice until you're 80? Now, if that's you, and I've got your attention now, guess what? You're in the right place. So, firstly, let's talk about who this is for. It's for clinicians who want to improve the value of their practice, but don't know where to start. It's for practice owners who struggle with the complexity of staffing issues and HR issues. It's also for professionals who are prepared to learn and improve. And finally, it's for owners who want to understand and reduce their risk. If that's you, you're in the right place. So who is this not for, conversely? It's not for you if you're a practice owner who's doing just fine. It's not for clinicians who are on track to retire on their own terms. It's certainly not for professionals who have no HR issues. And it won't be for you if you're not willing to make some positive changes in your life. So if you meet these criteria, sign off now, and I do wish you the best. So why am I doing this? Well, over the years, I've come to discover that practices that run like clockwork have one thing in common. It's a system. And more than that, it's a system that ties together people, process, and technology. Now I'm looking for some like-minded individuals who want to learn how to avoid the most common pitfalls in a practice. And they're things like failing to manage their risk with processes, failing to manage their people, and failing to manage the security of their technology. Now, I don't know if that's you yet, but we'll see. So, over the next 30 minutes, I'm going to show you, firstly, how to de-risk your practice in 3 ways. The first thing we'll do is talk about introducing processes into your practice, with some real examples. By actively managing staff, we'll talk about the secrets of managing staff. And by the way, there is no secret sauce, but there are some key practices you can put in place to reduce the stress of HR. And we'll talk about how you can vigorously manage your technology to reduce the risk of cyber attacks and privacy breaches. So by following these few suggestions, you're going to be able to have a practice that lets you spend more time with patients and less on admin. You'll learn how to create a practice that will be very saleable because you'll have systems in place that consistently provide great patient outcomes and is low risk. And you'll improve your patient outcomes because you'll have time to actually do things correctly without stress. So, why listen to me? Well, I've worked in healthcare across multiple care settings for over 30 years. I started life as a pharmaceutical rep, calling on doctors and pharmacies, then specialists and hospitals. And during this time, I got a first-hand look at how practices run, the good, the bad, and in some cases, the downright ugly. I also worked with medical device companies and then with healthcare IT companies. I've run multinational companies and startups, all in the healthcare space. I was a senior executive in several of these and then left to work as a consultant to startups, which means I've come across and learned how to fix most of the problems that you face on a day-to-day basis. I've worked with many companies to help them align their values with how they work. I've restructured teams to get optimum performance, and I have created a number of profitable businesses across the region. I've got extensive experience in people management. I've hired and fired staff and have managed large and small teams both directly and remotely. I've managed teams in Australia, New Zealand, Canada and Vietnam. So I know how hard staff can be and how hard it can be to get the right people in the first place, but also how difficult it can be to get rid of the wrong people. I'm also a cyber and privacy risk expert, especially regarding healthcare. Now, I've seen and experienced some real shockers when it comes to security, or what sometimes passes for security. So just to allay any fears you may have about a hard sell coming up, there is nothing on sale here today. You can't buy anything from me here, so keep your wallet safely closed. But if you stay until the end, I will have a gift for you that will dramatically change your results when it comes to building a successful and sustainable practice, and also a way to have all your questions answered for free. So let's move on. Are you doing things the hard way? Are you constantly chasing cash flow? Is cash flow a constant source of worry for you? Does an irregular money flow stop you doing things that you want to do in the practice or in your personal life? Have you any idea of your risk profile or how to manage it? Have you ever sat down and thought about risk in the business? You have locks on the doors, I'm sure, but do your staff have strong passwords on their computers? Passwords that are changed frequently? Or does your practice share login details? Staffing issues, hiring, firing, performance management pain. Do you get reflux whenever you think about your staff? What about when you come to hiring or firing someone? Do you have a formula to do this? Are you at risk of harassment claims or bullying claims within your practice? Would you actually know if these are going on? Is there zero or little marketing or patient engagement happening? Do patients just turn up and sit for long periods of time in your waiting room? Or are they greeted with a smile and a positive vibe when they walk in? Are they engaged? Are they educated? Can they access information relevant to them via an online portal or your website? How about the simple act of making an appointment? Can they get an urgent appointment when they need one? Or are they simply told, sorry, no appointments today? Do you struggle to find advice on how to run your practice as a business? Do you know where to turn for advice? There are thousands of small business consultants out there, but how many actually understand healthcare? Now, it doesn't have to be this way. But first, you do need to understand that you're running a business, not just a practice. Now, you became a healthcare professional to help people lead healthier lives. And you got into business to build a team of people to help even more people get healthy. But when you discover it's not good enough, and you find that being a great clinician just doesn't cut it, you have to be a successful business person as well. And this is a whole new skill set that they didn't teach you at university. But where do you go? Do you do a 4-year degree in business? 2 years to get an MBA with nothing specific about running a practice? You could do with someone who has actually been there before, I guess. Now, as Dr. Corey Schuller points out, it doesn't matter how smart the doctor is, if they can't keep the lights on, they can't help anyone. So let me tell you about an easier way. You can reduce the risk of staff undermining your practice, either on purpose or accidentally. You can put a system in place that manages processes, people and technology, meaning a well-run practice is valuable when it comes time to sell. And all of this leads to great patient outcomes because you have the time to actually spend with your patients instead of running admin tasks. And you can easily understand your risk universe and how to create a practice as low risk because you took the time to put a system in place. Now, I should point out that it's important to understand that results will depend entirely on how you engage with this program and implement what you learn here. I can give you all the tools and all the information you need to improve your practice dramatically, but the future is in your hands. So let me now reveal how to de-risk your practice around processes. The first part of our system. But first, let me tell you an interesting story about a clinician who thought he had insurance for cyber events. Now, recently, I had a discussion with a medical doctor about privacy, security, insurance, and a number of other things. For this exercise, let's call him Bob. Bob told me that he thought his insurance cover from his medical defence organisation covered him for cyber liability. Now, I suggested it might be worth checking the fine print. Now, the other day, Bob called me up to say he'd checked with the medical defence organisation about his cyber cover. After this discussion, I got off the phone. I immediately thought of 2 songs that summed it up perfectly. Things That Make You Go, by CNC Music Factory, and How Bizarre by OMC. Now, according to Bob's insurer, he's actually covered for actual or alleged breaches of privacy or confidentiality. But his policy excluded things like fines, such as those imposed by the Privacy Commissioner. It excluded damages awarded by the courts, such as in a civil claim, or even repayments to Medicare. Now, additionally, there are other exposures like the impact of the practice through interruption and loss of revenue. There's things like costs of forensic investigations and remediation of patients. And none of these things were covered by this policy. So I just said to him, what does it cover? So what's the financial impact of this to Bob? Now, he may have a regulatory fine imposed by the Privacy Commissioner. He might quite possibly incur both economic and non-economic damages. Now, on average, the Privacy Commissioner in recent years has awarded around $15,000 to each claimant in cases of healthcare data breaches. Under the new mandatory reporting laws that come into law in February 2018, just to remedy the breach based on 1,500 compromised patient records, this cost could escalate well beyond $1 million. If you add in fines and damages, then the amount not insured could cost most people their business, their home, maybe much more. So what to do? And what does he need covered? Bob, in this case, needs to consider a specific cyber liability policy that's tailored to cover his actual risk and his risk appetite. To do this, Bob needs to firstly understand his risk profile and the financial exposure he has, including any potential vulnerabilities. Now, something we've encountered in assisting healthcare professionals is that many practices have informal policies around privacy and cybersecurity, but these are often just what we do, as opposed to being formally implemented in writing and in practice. By undertaking a risk assessment, it's likely to provide a much higher probability that you'll be able to get cyber insurance in the first place, and perhaps a discounted premium. Additionally, it'll help your practice with any future accreditation requirements, and if you have a breach, it will help to minimise the fallout because you actually took privacy seriously and proved it by addressing any vulnerabilities. Now, before you take offence, I understand everyone really does take privacy seriously, but can you prove it to anyone? So, as part of your business planning process, you need to identify all areas of risk and create a plan about how you're going to manage this. Now, it should cover things like disaster recovery, loss of key staff, medical misadventure, or illness on your part. Now, your risk universe is made up of three things. Firstly, your appetite, the amount of risk that you're prepared to accept in pursuit of your goals as a business. The second part is your risk tolerance, which is the most risk and the type of risk that your business can actually accept. And finally, it's made up with your risk capacity, which is the level of risk your business can accept given your capital position and equity. For example, if your business is well cashed up, you may have a larger tolerance. But if cash flow is tight and there's little in reserve, then your tolerance will probably be minimal. Now, risk comes in many forms. It can be fire or burglary. It can be staff filing vexatious claims against the practice, or maybe well-founded claims. It may be your practice is located in a flood zone. Or maybe just the fact that your business partner is a lot older than you could create risk. What if something happened to him or her? Would the practice continue without major impact? Do you have a contract in place between you that specifies very clearly how the equity would be distributed in case of someone dying? So the second thing to do is establish policies and procedures and ensure that staff are trained properly, and make sure these are written down. Now, your staff may well be very good at what they do, but does your practice have policies and procedures on how to handle a multitude of situations? Are they written down? Usually everyone just gets on and does things, but policies need to be written down so you can point to them and say, we enforce these. As important is the need to actually train your staff on these policies and procedures. Do you have an induction program? Does your practice provide regular staff training to ensure that everyone knows the importance of, say, specimen handling, for example, or the absolute necessity for patient information to be kept private? So the next thing to do is to review your insurances and make sure that you're appropriately insured, especially for any risk that's outside of your control. Now, everyone hates to pay for insurance, but it is a fact of life that we need it. So you should regularly review your insurance coverage. Do you have adequate insurance for fire, flood, all those physical risks? How about key person insurance, income protection, cyber liability? My suggestion is to find a great broker who understands the healthcare market and then work with them collaboratively to ensure that your risk appetite is married up with the appropriate cover. So the final thing is to review any specific standards that are applicable to your practice and ensure that you comply. Now, standards are a bit like insurance. We need them, but everyone hates the compliance part. So getting ready for accreditation can be a nightmare. But if you wait until a few weeks before the assessor's due, then that will just add to the stress and the load. If you get the practice in order now and maintain a well-run business, the accreditation will in most cases look after itself. As part of your business planning regimen, you should be reviewing the appropriate accreditation standards to which you need to be accountable. Making subtle changes as you go along will be far more pleasant than trying to do a major catch-up every couple of years. Now here's how this might apply to your situation. When you understand your risk, you can sensibly manage it, and that means you'll be able to sleep at night. Now the first step is, do you have a business plan? If you do, you'll have the confidence that your practice is running like a well-oiled machine. You'll be comfortable in the knowledge that your insurance cover is appropriate, and that if the worst case scenario happens, you'll be able to carry on. If you don't have a plan, how do you know where you're going? How will you know when you get there? As someone famous once said, if you fail to plan, you plan to fail. As I said, you do need to have a plan. And yes, there is some time to put it together, but it doesn't have to be war and peace. A couple of pages to clearly articulate where you want the business to go and how you'll manage challenges, such as risk, is all you need. It doesn't have to be a long, drawn-out process, nor expensive. Now, there are hundreds of coaches out there who can guide you through the process, or Google has thousands of free templates. Either way, you need a plan. So in this plan, you need to identify the risks that face your business. As I said before, it's things like the physical risk, fire, flood, cyclones. There's people risks, staff, intruders. Did you know that over half of privacy breaches are caused by staff? There's patient harm. The more busy you are, the more stressed and worried about running things, the less time you have to spend with your patients. Rushed consultations equals less care, leading to high probability of harm. And there's technology, a server failure, long-term power outages, that type of thing. What happens if that server that lives under the bench in the staff kitchen gets someone's lunch spilled all over it? So once you've identified these risks, we can then proactively manage them. The first step is to decide your risk appetite and tolerance. If you have a couple of $1 million sitting in the bank, well, firstly, you probably don't need to be here. But if you did, you may well say, okay, I can self-insure for some of this stuff. It's more likely that you don't have that sort of disposable cash. So you will need to decide, either individually or as a business, with your partners, just how much risk is okay. Now that's a decision that only you can come to, but you do need to consider it. Wherever possible, eliminate the risk. Perhaps it's as simple as deciding that disaster recovery looks more like having a practice management solution that is hosted in the cloud, so backups and accessibility is more or less guaranteed, as opposed to that server in the lunchroom that could wear someone's cup of soup. Now that means that a possible major risk is no longer a worry, and you can move on to the next one. Eliminate things that produce undue risk. Some things are obviously not able to be eliminated as such, but some can. If your location is flood prone, is it an option to relocate? Now, a flood would be devastating in terms of the cost to replace equipment, fittings, even structures, but perhaps you can accept a risk of a 1 in 100 year flood. Make sure you have strong contracts for all your external contractors as well as any internal staff on contract. You get the picture. And finally, make sure you insure for uncontrollable risk. When you've decided what you can and must live with, you need to insure for that risk. And a good broker, as I said, will help you through this process. And use one who understands the healthcare business. So all of these things will help you come up with a disaster recovery plan, and you do need one of these. It's no good turning up the morning after your server crashed or the building burnt down and wondering what to do now. Building a contingency plan is critical. And again, it may sound daunting, but it doesn't have to be. So next, how to de-risk your practice. Let's talk about people. The secrets of managing staff. First, let me tell you about a practice where bullying was allowed to become a major issue. This practice was a specialist medical practice where the doctors allowed the practice manager to run the business almost without restraint. She hired, fired, did the banking, all those sort of things that practice managers tend to do. What they didn't realise, and perhaps they still don't, is that this practice manager was a bully. Now, she wasn't the stand over someone and yell in their face type of bully. She was much more clever than that. She was quietly passively aggressive. Now, she would quietly work on individual staff members and create divisions with other members. She would say hello to certain people when they arrived and not to others. She would purposely change rosters or patient bookings without telling the clinicians involved. She was rude to patients. She spent much of her day dealing with personal issues involving her family. After getting several of the clinical staff to leave of her own accord, she would then set her sights on the next victim. Now, when a key clinical contractor complained about her to the principals, they asked this clinician to document the bullying. Now, that's a bit hard to do. Now, how do you document that X didn't say hello this morning, but did to everyone else? Now, on paper, that looks fairly petty. But it's still bullying. Now, when this clinician complained again, the principals brought in a human relations expert from the AMA to lecture everyone on the practice about just how bad bullying is and not to do it. So nothing happened for a week or two. Then the bullying kicked back in with a vengeance because the practice manager knew exactly who had dobbed her in to the principals. Now they went on their merry way thinking all was hunky-dory until late one Thursday afternoon, the clinician in question simply walked into one of the principal's office and resigned on the spot. Patients had to be cancelled the next day. Life was in upheaval. And I actually think that to this day, they still have no idea what happened. They were very lucky to have avoided legal action against their inaction. So, how do you manage staff simply? Here's how you can do it. The first thing is ensure when you're hiring that you have a set of criteria to which you manage the interview process. You need clear and precise position and role descriptions, which define the role and the expectations of you and the practice. Be very clear on what is and is not allowed. For example, the use of personal phones during work hours, the use of the practice internet to access Facebook and that type of thing. Be very clear and ensure that when you hire someone, they know all this. If you don't know how to do it, use a recruiter. Also, your professional body that represents your area will have templates for interviewing and for role descriptions. Using a simple template like this one will formalise the process, but also make it easier to compare candidates, making your hiring more objective. The next thing to do is set up induction and training programs. When you start someone, make sure that you're there on their first day to welcome them and show them around the practice. You need to induct the person on fire procedures, accessing information on the network, and other policies and procedures. Now this could be an hour or a week. That depends on how thorough you want to be. At a minimum, you need to be able to sign off and have them sign off that they've been shown the fire procedures and other policies and procedures. If you don't do this, it could come back to bite you. Imagine, heaven forbid, you have a fire in the practice and that new person who started last week didn't know what to do and was injured or worse. Liability would be swift and costly. Now your staff should have regular training as well, provided to keep them up to date. This could be a mixture of online or face-to-face, or at least required reading that provides them with updates or revisions of the practice policies and procedures. Remember, we said these need to be written down. Now, using an induction checklist like the one on the screen now will give you the ability to ensure that all staff are properly trained when they start. You can also get them to sign off that this did happen. Just another way to reduce risk by having a hard record that training was provided. The next thing to do is conduct regular performance reviews and provide feedback. You should set up key performance indicators, KPIs. And then you should review these and provide feedback. The sandwich method for providing feedback is very good. Always praise, then criticism, then praise. Where criticism is necessary, obviously. And the final thing to do, if you don't know how to do this, or you don't have the time to do it, or the skills within the practice, outsource it. There are lots of people out there who can do this for you at a reasonably minimal cost. So how does this apply in your practice? If your staff have clear policies and procedures that have been trained during induction and regularly afterwards, they'll work more productively and be happier. And this flows on to your patients. Happy staff, and they will be happy if they know they're treated fairly and given feedback, will look after your interests much better than unhappy staff. If your staff are unhappy, and by the way, it's your job to know this, then at best they may put off your patients. But at worst, they may actually steal from you or sink your business altogether. It's imperative that you interact with your staff. Now by that I don't mean you have to go out and have drinks with them on Friday nights and be best friends with them. but you do need to know how they are feeling. Induct them, train them, and provide feedback. Now, finally, as I promised, I'd like to show you how to de-risk your practice by managing the security of your technology. Here's another story you may find interesting. Now, what actually happens if you have a privacy breach, either cyber-related or just an oops moment? So a healthcare record can fetch up to $50 on the black market. This is compared to around $3 for a credit card. You can see why criminals want to get to your data. If the average two-doctor practice has around 4,000 records, that's big money for the thieves. Now, they are hunting for personally identifiable information, PII, in the way of health records, because they can then conduct things like prescription fraud, ID theft, insurance fraud, fraudulent care to someone else under your patient's name. Now, if your practice has a data breach, the Privacy Commissioner can fine you up to $1.8 million for a company, or $350,000 for an individual. From February 2018, new legislation will be in place that enforces mandatory breach notification. All healthcare practices will be obliged to report any data or privacy breach to the Privacy Commissioner, to AHPRA, and most importantly, to the affected patients themselves. Now, this is going to open the Pandora's box of class litigation. So, the cost of reparation for a breach averages around $350 per record. So again, for that average practice with 4,000 records, that runs to about $1.42 million. Normal practice insurances do not cover this sort of loss. So what would an unplanned $1.4 million do to your practice? Would it cause the loss of your business perhaps? Loss of your house as well? Maybe your family? There would certainly be a loss of reputation. On average, over half of patients will leave your practice if you have a data breach. Could your practice survive this? So how do you reduce your risk of cyber or privacy breach? Let me tell you now. Do you have written cyber privacy policies and procedures in place? Do you test them, especially disaster recovery? Are they part of your staff induction? Are they part of your ongoing staff training program? And do you have solid contracts with third-party providers, especially people like IT providers? So things you should be doing is implementing different access levels for employees' access to personally identifiable information. Always work on the principle of least access. If someone leaves, always immediately stop their access to information. You should use two-step verification processes. You should transition from paper records if you haven't already. And as you no longer need those paper records, shred them, get rid of them. Also, make sure you do physical things like locks on the doors, deadlocks, alarm systems to prevent break-ins. Just those physical safeguards. In summary, the goal is to create a security culture. It's a state of mind. Remember the hand washing promotions a few years back? They were repetitive, almost boring, but now you probably don't even think for a second about washing your hands. You just do it automatically. Security needs to be the same. Now, if you're wondering how you can use this, here's how. The first thing to do is run a complete risk assessment of the practice. Now, many medical practices use a variety of technology from faxes to kiosks to web portals. To ensure compliance, a risk assessment should be done on the current systems to highlight areas in which compliance is not enforced, and to expose areas where changes might be needed. Always ensure the latest version of the software is being used, including any security patches from the vendor. Now, if you outsource your IT to a third party, you should be asking them if this has been done. The risk assessment should also look at policies and procedures that are in place to manage access to personally identifiable information. Now, I know this sounds big and scary and expensive, but it doesn't have to be. The second thing to do is prepare for disaster before it occurs. All data handled by medical practices should be safe from both loss and corruption. One of the main ways of ensuring that data is not lost in case of a mishap is the backing up of the medical data, and this should be done daily. Data should be backed up in an off-site location to ensure that in case of incidents of natural or man-made disasters, the data backup is not destroyed. Antivirus programs need to be installed on all computers to ensure that the data is not corrupted or destroyed by viruses or held to ransom by cyber criminals. You should implement an ongoing employee training program, as we talked about before. Any system is only as strong as its weakest link. And in some cases, poorly trained employees or temporary staff are the entry point for hackers into medical practices. It's also these staff who are more likely to have an oops moment and accidentally release confidential information. Now, practices might have excellent processes and systems, but if employees don't use their passwords to securely access records and files, the system security is rendered completely useless. And anyone can then get access to these records. Practices need to continually train their staff on how to follow the right security protocols and ensure data integrity and security. When you're purchasing equipment with security compliance and compatibility in mind, you'll lower your risk. New equipment bought for a practice should be compatible with existing systems and should also offer enough security features. With the advent of connected devices, the so-called Internet of Things, it's critical for the devices to be secure and kept up to date, more importantly. Before making any major purchases, do a thorough review of the product to ensure that both security and compatibility will be met. This includes diagnostic devices, computers of all kinds, and even printers. And finally, collaborate with affected parties. Changes which need to be made to bring about cybersecurity and privacy compliance affect many people in the practice, and also external providers. Affected groups should be offered training, and management must ensure that staff understand the importance of compliance to everyone involved in the practice. Also, ensure that your key staff are trained on what to do if there is a breach. A comprehensive disaster plan, as I said earlier, is essential and must be practiced regularly. So, at the outset, I promised to teach you 3 things today. The first one was how to de-risk your practice by putting processes in place. The second one was how to de-risk your practice by actively managing your staff. And the third one was how to de-risk your practice by vigorously managing the security of your technology. So, how did I do? Now, here's the real opportunity as I see it for you. You can have a high-performing practice with happy staff leading to healthier patients. By making some changes and actively running your practice as a business, you can have happy staff and patients who love you and your practice. You can have a clear picture of your risk universe and be able to manage that, leading to peace of mind, not to mention better mental health. By reducing risk, you can be more profitable, meaning an exit at your pace. Now, many practices are being bought up by corporates, so if you have a well-run business, you'll optimise your return. With the corporatisation of healthcare practices going on, a well-managed, profitable practice will attract a premium price should you choose to sell. The corporates won't be in a position to come to you and offer to bail you out, so you can become one of their employees on the hamster wheel. Now, the good news is it's not about whether you have the complete ability to do this right now. It is about whether you can take one step now and then learn the rest as you go, with some help along the way. So what do you need to win in this business called healthcare? Well, firstly, you need the right plan. You need to have the right systems in place. And you also need the right help. So what now? You have a choice to make. You can click away and forget everything I've just told you. That's fine. But that also means that nothing will change. But if you really want things to change and be different, and to change your life in this area, here's how I can help. Now, I told you there would be a gift at the end, and yes, we're nearly at the end. Now, I have set aside some time in the next 48 hours to speak to 15 people about how you can apply these ideas in your practice starting today. Whatever your biggest problem is, I can help you solve it. On a 45-minute consultation, I'll help you in 3 ways. Firstly, I'll talk to you about your biggest challenge right now. Second, I'll help you solve it. And third, I'll set out a step-by-step plan as to how you can reach your end goal without all the issues you currently face in your practice. Now, just a reminder who this is for. It's for clinicians who want to improve the value of their practice but don't know where to start. It's for practice owners who are tired of staffing and HR issues. It's for professionals who are prepared to learn and improve. And it's for owners who want to understand and manage their risk. Now, if you can say yes to all of this, then I'm happy to help you for free during a 45-minute strategy consultation. So why do I do this? Well, if we make a connection and you're absolutely positive that I can help you achieve your goals, then you may want to apply to work with me. If it's a win-win for both of us, fantastic. If not, that's no issue at all either. Now click the button you see below. We have a 48-hour window available only for 15 people. When you click on the button, it will take you to my online calendar, and you can make a time that suits you for me to call you for a chat. And on that 45-minute consultation, as I said, I'll help you in 3 ways. I'll talk to you about your biggest challenge right now. I'll help you solve it. And I'll set out a step-by-step plan as to how you can reach your goals without all the issues you currently face in your practice. So click the button now, make a decision to make positive change, and I look forward to chatting with you very soon.